Authorities are concerned over the low numbers at vaccination sites. They're having to combat vaccine hesitancy as well as a lack of information around the jab. The health department says it doesn't have enough money to run effective campaigns. This despite the 150 million rand Digital Vibes tender scandal hanging over their heads. So what now? eNCA's Govan Whittles has been following the story. Joins me now. Hello, Govan. Just give us an idea of how badly the vaccination numbers have dropped since the beginning of August.
Yes, Sally. So if we look at a 7-day average, they've dropped by almost 100,000 in comparison to about 3 weeks to a month ago.
That's per day, is that right?
And that is per day, yeah. And if that's the average number over a 7-day period per day is about 122,000. And actually much higher than that. But it has dropped because of what the scientists are saying is vaccine hesitancy. And at the moment, they're not only looking at by how much it's dropped, but the causes of that drop. And first, they were looking at the information campaign, which was rolled out by the Department of Health, and we heard a number of scientists coming together calling for an urgent information campaign to respond to fake news. They've now taken it into their own hands, particularly SAPRA and the National Immunization Safety Expert Committee, which is trying to assure people that the side effects associated with the COVID-19 vaccine are not those that they're reading about online, particularly on social media, and they really, that the prospect of dying after taking the vaccine and that the death has been caused by the vaccine is 1 in a million at this stage, almost 2 in a million. So they want to reassure people that the vaccine itself is safe and that the negative effects of the vaccine afterwards are not really caused by the vaccine, and that's according to the studies they've conducted. Let's have a look at what the Immunization Safety Expert Committee had to say.
So now, why do we want people then to report these adverse events? Exactly, so that we can look at these adverse events when they are reported, so that people can know, they are safe when they experience anything. They can report it and it will be investigated. Feedback is then given to people out there. And this is all about maintaining the confidence in the vaccines and in the immunization services. So, all deaths, for example, there's been a lot of discussion about the deaths that followed amongst people who got vaccinated. And none of those deaths up to date have been caused by the vaccine. So they are not related to the vaccine. But death is very serious. So all deaths are considered very serious and all deaths are investigated. But it's not to say that because they are investigated or because they happened after vaccination, that they were caused by the vaccine.
So in a sense, it seems, Govan, that the health concerns way overblown for a vaccine that is incredibly safe. But the government also coming under fire that it's not actually getting the information out, so that those who are slightly hesitant are not being reassured enough to get the vaccine. Tell me more about that.
Sally, this follows from reports at the weekend in which the health department admitted to the Sunday Times that it doesn't have enough money to mount a fresh information campaign. And that criticism of the health department's campaign or lack thereof has been construed as affecting the growth in vaccine hesitancy. But today, the government, through the Government Communications and Information Services, GCIS, saying that that's not the case because communication around COVID-19 and the vaccine has not been restricted to the health department, that the GCIS is working with its partners in organized labor in communities as well as businesses to try and localize the message around the vaccines, take it to the communities and give it to people in their own language using local influencers, as the Deputy Director General had said. And let's have a look at what he had to say about government's information response to the vaccine.
We have a very solid communication partnership, including which the much spoken of COVID comms, our dear colleagues there. We have a national communication partnership that meets every single Tuesday morning between business, government, organized labor, and the community constituency, where we actually are dealing with this sharing resources. Any shop you walk into, like a macro or a supermarket or Boxer or whatever, and you see that stay safe device that you see behind me here, it's because they've come to the party.
So, Govan, as part of the attempt to get out the correct information about the vaccines, they've also launched an app today. Tell me more about that.
Yeah, SAPRA is officially launching this app on Friday, but essentially this would correlate the information around the adverse effects after taking the vaccine and present it to the public in a manner which would clarify their concerns around the symptoms they may be feeling after taking the vaccine. Also explain to them how long that's going to last and which is serious and which aren't. And this app is part of SAPRA's response to the vaccine hesitancy, but also to the growing fake news around what the vaccine does, which some analysts are saying has contributed to that dramatic fall of the number of people getting vaccinated per day.
Thank you so much for that update on such a critical issue. Govan Whittles reporting there for us. Now,